Got it. Now, you might have mentioned this already, but you mentioned that the second round of funding is you anticipate to help maybe another 7,000 veterans or so. What was the number for the first round of funding? How many veterans did we help using the first $63 million?
566
units.
And the 7,000 is over the life of the $600 million, not in this next round.
Over the life of the $600 million.
Right.
Can you define that?
We think we will, when we build all the housing that we can with the $600 million, we think we will be serving around 7,000 veterans.
And their family members.
And their
not just
members.
It's not for just the second round of funding,
Right.
then, so to
The
speak.
second round will be something a little more if we get the entire $75 million out than the 566 we did in this round.
I see. Got it. Now, I noticed in one of the presentation slides, it mentions that women are twice as likely as men to become homeless. Now, and I was wondering what the program does to address these subgroups. For example, women and folks with mental illness or LGBT, for example. What specifically are we doing to address these subgroups?
Okay.
If any.
Within the guidelines, and we're wrestling with that very issue right now. So we do not have an ultra strong approach to it just yet. Within the guidelines, we have outlined how developers or providers could build same-sex projects or programs only, what they would need to go through in order to potentially be successful with that. We've implemented in this round of the guidelines best practices for serving vulnerable populations, how to make their facilities more secure and potentially friendly to vulnerable populations. And in going forward, we're continuing to work with stakeholders in trying to figure out what sort of changes do we as a state or does legislation need to be made to be able to better serve these more vulnerable populations.
Got it. Now, a follow-up question to Ms. Patterson. I think you talked about several recommendations, one of which was in regards to data collection, I think, which has been asked by my two colleagues already. But just a clarification question. Were you referring to the actual data collection or the sharing of data within, let's say, or amongst the various agencies? Yeah, I think you mentioned one of the specific recommendations was that you recommend a standardized kind of entry point, and were you actually referring to is the underlying problem lack of data, or is it lack of communications within or both? So then the recommendation you made specifically, i.e. to have a standardized entry point, for example, how would that work?
And there's probably others that could speak to this better, but each county has a coordinated entry system.
Got it.
Each county in the state of California has a coordinated entry system which they use to help deliver their continuum of care dollars. They have a reporting system, which is the HMIS system, which is the homeless management information system, but the information in each of those counties could be different. And that's the information that goes up to the federal government to help report on their federal continuum of care dollars that come back to each of those counties. And so as part of that infrastructure we've created, counties are talking directly to the feds and feds are talking directly to the counties. But those are on the housing continuum of care side. Right. And so to integrate into that data collection and making sure that's including the veterans information, because often those veteran service providers aren't at the table to create those coordinated entry systems or as part of that overall HMIS system, wouldn't you say?
So I'm not going to address the coordinated entry piece. I not quite know enough about that. But with the HMIS system, HUD came out and said, hey, we need data, but we need the same sort of data from everyone. It was a great, bold first move, but we're not going to fund it. So they put out guidelines to tell you what your system needs to look like, how big your fields need to be, what type of field the data needs to be, what kind of data you're going to collect, although they don't necessarily collect data on veterans. And they left it up to all the continuums of care to build their IT system to collect this data. And then they send that data via an electronic file, probably through a spreadsheet or similar type data structure, to HUD annually as an aggregated amount of data. And some of that data may or may not be relayed to the state, depends on the programs that require it. But because HUD took that first bold step and said, here's kind of the framework on how you're going to build a system so that we can get some data we need, many IT firms out there have built web-based HMIS and other types of data gathering systems. They're kind of like when email first became big and AOL was $25 a month to have your email system. And they're literally becoming that portable and easy to use with data entry. And so it's where we're at now is we have 38 to 40 COCs across the state. They all have developed their own HMIS reporting system to be able to report back to the feds. Some of them may be similar or may be identical because they're using some of these off-the-shelf products. But what they're relaying to the people who are trying to inform policy is aggregated data. And I've asked for some reports out of that to try and see if we could run data. And I asked it from one COC. I got the same report 2 different times, and the data was different in both reports. So it leads you to wonder, is the data correct? And it came in different formats, meaning that fields were in different places or differently sized, so it wasn't consistently necessarily coming out. But what we're lacking, from what I've seen at a state level, is that data to help us inform a policy direction, to be able to see how are people being served, what is a good outcome, who's doing the best outcomes, who has capacity and who doesn't. We're relying on a variety of fragmented reports to the different funding agencies to try and put a picture together instead of having one centralized picture.
How can that issue be addressed without legislation? Or should it be addressed with legislation or regulation?
It will probably need legislation to help standardize and give the authority to that entity that's going to run housing policy, which is probably HCD, to be able to hand out a system and say, this is what you're going to use, this is how we need it. Giving just that authority to HCD to set that policy is what's needed, and then some funding to go to behind it. These off-the-shelf systems are fairly inexpensive from my initial research. I'm not at a point where I can give you dollars on what it would cost. I still am talking with HCD and trying to look around at what the world is out there and how costly could they be and what might be able to work within the state. But I don't think it will be an extreme expense. I think it's more like buying, to some extent, I hate to do this comparison, Microsoft Office, manipulating it to fit within your organizational structure, and then implementing it. They're pretty sophisticated at this point.
And if I can just add, I mean, I think, we can't get there if we don't know where we're going, and we can't do that without data. And so that's part of this, is how do we really set the policies and show that we're moving the needle broadly on housing our veterans and ensuring that we're getting them off the streets if we're not tracking that data. And so I think that's one piece, and the best place to do that is to really kind of reach down into the continuum of cares and make sure that they're consistently tracking data, and that we are able to kind of tap into that and to help integrate that. But I think the other piece too, one of the reasons that HUD really pushed in this direction was that they were finding that individuals, many of which are likely, chronically homeless veterans, were cycling through the system. So, we're talking, to some extent about big picture today, looking at aggregate data, but the reality is what folks were seeing, that were, down in the trenches, trying to ensure that folks were really getting assisted and stabilized and getting off the streets, was that, a single individual would cycle through social service providers, shelters, transitional housing, multiple times, and no one was tracking that. And so, one social service provider would see them over here, and then the next week they would be over here. And so we have no idea whether or not that person is being appropriately housed and stabilized. Mm-hmm. And so, that's another function. It's really the human face of what all of this data means, is that in order to track it in the aggregate, that we're ensuring that one individual that is jumping from social service provider to different housing, transitional housing, shelters, that individual is getting off the streets and stabilized, and their underlying conditions are being addressed.
Great. Thank you very much. One more question. Ms. Brown, go ahead.
Yeah, I just have one thing to ask. You were saying that experience of the operator is one of the pillars of what you asked for in the RFP. What kind of experience would the operators have to have? What were you looking for?
What she was referring to is the service provider, those who are actually providing all of the supportive services to the veterans, that they be experienced and potentially have some experience with veterans.
Okay, but we haven't done this before.
But that we've got service providers across this state that have been serving veterans in supportive housing and transitional housing for decades.
Okay, that's good.
So we've got a base out there, and we're trying to expand that.
And trying to expand that, because they've dealt with veterans and the veterans world. There is a housing, there's continuum of care, there's health, there's Medi-Cal, and to bring those and have some cross-training and some capacity building so that those service providers that have served chronically homeless may not necessarily know about veterans. Veterans may not necessarily know about housing homeless folks that formerly served in the military that don't identify as veterans. So the ability to have those veterans who have those critical cultural competencies help educate those housing service providers, and those housing service providers who have experience in dealing with chronically homeless bring some of their knowledge to the table so that we can all learn from one another. It's very critical. So building capacity.
But it sounds like that might be class that somebody should teach in a college, a junior college or something.
Yes, we're working on that.
Okay. The other thing is you're looking for shovel-ready projects?
As close as possible. Obviously, what we want to do is deploy this money as quickly as possible, as effectively as possible, bring quality projects online so that we can get folks off the streets as quickly as possible and appropriately house veterans as quickly as possible. So, ideally, readiness really needs to be a factor so that way, our money isn't just sitting there, but it's being invested to very quickly ensure that we're making an impact.
Thank you so much.
Thank you.
Thank you for all that you have imparted to us today.
Thank you.
If there are no further questions, I want to thank the ladies for being here. Before you go, can you put on the record the date, the deadline for the second round of funding? Put it on record,
We're
please.
looking at June of 2016 for the deadline. Oh, so I'm sorry, the application deadline?
Application deadline for the second round of funding,
Let's see. December 14th. Then.
December 14, 2015.
Yes.
Very good. Thank you, ladies, for being here. So with that, I'd like to introduce the next panel. We also have 3 speakers for this panel, and they're going to be sharing their perspective on the first round of VHHP program. And joining us are Mia Kang, who is the president of Domus Development. We also have Mr. Stephen Peck, MSW, who is the president and CEO of US Vets. And finally, we have Mr. Ken Trimble, PE principal of Trimble Shots LLC. So with that, welcome to the Capitol, and let's start with Ms. Kang.
Thank you, Chairman Chow. Thank you for the invitation to be here today. It's quite an honor, and I think this program has really inspired a lot of people to pay attention to the plight of the homeless veterans, and at the same time do whatever we can to try to be innovative and bring these projects to fruition. And I think part of the challenge, though, is everyone knows it's very complicated to do real estate development in the state of California, whether it's high cost of land, opportunity, just finding the right site in the right location. That could be a number one stumbling block, let alone, of course, the financing and bringing projects together. So my company, Domus Development, we are a recognized leader for building and managing innovative green, infill, affordable housing with an emphasis on special needs populations in California. And we've used our expertise to develop catalytic projects that have not only provided new housing but have also invigorated blighted communities to create more investment and to create more walkability, and the green aspect of how we're able to position our housing so that they take advantage of transit and walkability is also very important to us as far as building new communities, but at the same time making sure these communities can serve special needs populations like our veterans and integrating them into existing communities is really important. And as a tenet to the kind of work that we do, some of our projects, we have about 30 projects that are either completed or under construction. One of them is La Valentina, which is not far from here on 12th Street at the La Valentina Light Rail Station. And that project won the U.S. EPA's Best Smart Growth Project of the Year nationwide. So we take projects to another level of development, at the same time integrating low-income families. Sustainability is the first net zero building ever built in Sacramento, at the same time increasing transit ridership. So again, we bring these elements to all the projects that we build. We also built Garden Village, which is a project in Sacramento County, which was the first project in the nation to use the HUD 811 program with Cal HFA in the nation. So we were able to cut new ground, figure out new ways of doing things, and at the same time deliver the kinds of housing opportunities that we need for California. We also were awarded this year cap and trade funding for in the first round for a project called Anchor Village, which is a 100% veteran project in the city of Stockton with MHSA funding in it. We chose not to apply for VHHP, frankly, because of some of the complications with the program. But that project is slated for construction next year, and that project will be dynamite in terms of really reinvigorating downtown Stockton. What I'd like to talk about, and I'm going to sort of step away from, I think, and I'd just like to compliment, of course, the women that were here in bringing this project to fruition in record time. We know it was a daunting effort. This is a brand new program, a lot of complications, and we heard silo busting and messy collaboration ensued. We know that is challenging, and this is really, my comments are not meant to be critical, but at the same time just hear from the perspective of the people who are trying to make things work, trying to sort of fit that round peg into that square hole. It's not easy, but at the same time we know we have to collaborate, we know that we have to leverage as much as we can leverage to make these projects happen. So Domus had applied for 2 projects in this VHHP program, and they're on the list. They did not make funding cutoff, primarily because they lost significant points in the lead service provider category and in the supportive service plan. One of the projects is 53 apartments at the former McClellan Air Force Base. It's currently an empty dorm building that within 8 months could be turned into housing. Empty, we're in contract, fully entitled, ready to go. We got maximum points on readiness, maximum points for leveraging. But unfortunately, because of, frankly, we didn't quite understand how certain things got scored, out of the 18 points for lead service provider, even though my nonprofit service provider housed almost 300 homeless veterans in Sacramento. They're called the Sacramento Self-Help Housing. They're one of the lead service providers in the county for working with homeless vets. They got 9 points out of 18 for lead service provider. So that pretty much kicked us out of minimum point score. And also our social service plan randomly got, I think, 8 points out of 20. So again, we're sort of wondering how we make criterias clear. And one of the reasons for not getting full points is not articulating cultural competency with veterans programs, even though in our narratives was very tailored to veterans and the experience of our social service providers. So perhaps going forward there can be more clarity. If there are specific buzzwords that need to be in there or specific definitions, let us know, because again, this is all brand new. We're trying to bring all these pieces together. But this is, again, a building that is within 1,000 feet of a VA clinic, a VA dental medical center, and the PX. It is a former Air Force base. It is ready to go with improvements that have already been there, not to mention 10,000 jobs that are currently on the base at McClellan, and a very willing property owner who is thinking about ways that we can integrate jobs, future jobs for our veterans in the base. Yet I can't get there because we unfortunately didn't make the cutoff because of the way certain things were scored. So I'd like us to look a little bit at how we actually scored and the weight of the scoring. Because at the end of the day, these developments take millions of dollars to put together. Millions. And it requires sophisticated developers with great expertise in banking and finance, which of course, our partners understand, but at the same time, there seems to be a slight weighting that changes that. And the other project, let me just mention, was a city in Pittsburgh. We have a project that we designed back in 2011 for veterans, because currently we operate about 10 properties in Pittsburgh, of which we have many homeless vets that are there. And because of that, we knew that there was a great demand for veterans housing. So in 2011, before the crash, we designed 30 units designated for veterans. The market fell apart, redevelopment went away. It took us a little while to get our site back into contract. We managed to keep our entitlements, and we were very excited when this program came about. But unfortunately, the same thing happened. Even though we have a lead service provider who's a nonprofit who was the #1 service provider for homeless veterans, they scored 6 out of 18 points for lead service provider. Therefore, we didn't make the cutoff either. So again, revisiting how these criteria has been established and how you can communicate better to the developers out there, the clarity is going to help a lot. So going back to scoring, for the development team, developers can achieve, so for the points of experience, developers have a maximum of 5 points. So if you're a developer that's competent, you have 5 points in which that's weighted against. And the sponsor or owner also has 5 points. If you're a developer and you're an owner, experienced owner, you have 5 points. And as a property manager, you have 5 points. So total, 15 points. Lead service provider, it's 18 points. The lead service provider is not part of the ownership. They are contracted to provide social services. They are not the ones giving guarantees. They are not the ones backing all this up. They are not the one physically risking capital and effort to bring these projects to fruition. Yet we get 5 points as a developer, and the lead service provider, which we have an MOU that creates the contractual agreement in the application, is worth 18 points. So again, seems to be perhaps an opportunity to revisit some of these elements, which doesn't dissuade the fact that we absolutely know that wraparound services are critical to permanent supportive housing. We have several permanent supportive housing projects in my portfolio in which we're targeting homelessness and services, and all of them are successful. The development community, we understand the importance of social services, but at the same time, with no dedicated source of funding, and we all heard this, social services is ranked incredibly high, yet we have no money to pay for it. Yet experience is worth higher than the development team itself. I think we should look at that. It really, to some degree, it de-emphasizes the skill that's necessary to develop and to finance these projects if we are not weighting our development expertise either as equally or frankly even more than the service provider who is providing those services, who again is going to be paid to provide those services. They are not the ones risking capital and effort to build these buildings or retaining, we buy our land, we put in deposits, we're now holding all these properties I'm in contract for, I'm holding these for another year until I can get new financing. Again, reserving it for this veterans population. We are the ones at risk with risk capital making these things happen. Yet, again, because of our low scores and lead service provider, even though they're reputable agencies that deal directly with homeless veterans who have a very successful track record, more than 10 years doing this work, 9 out of 18 points, 6 out of 18 points. And so no matter what, the largest sort of component of the scoring is dedicated to social services and supportive housing. It's roughly 47% out of the 133 points available for supportive services falls under this, frankly, in my opinion, especially right after the application, black box, because we don't have control, we don't understand the clarity of the criteria. Supportive service totals, you would get 25 points if you targeted some of your units for supportive housing, which is great. So that was clear. That was clear to understand. The supportive service plan was worth 20 points. The supportive service plan was worth 20 points. That's higher than the financing plan. That's worth 15 points. And the readiness, which is 15 points. So that's all together. Readiness and financial leveraging, 15 points. Yet this written plan, and unfortunately, One of the things about plans is you can't get into the detail because you don't know who your residents are. So it's an umbrella. It's basically saying we're going to create these types of services. We know through our experience we're going to look at financial literacy. We're going to look at supportive medical services. We're going to do all these things, and we're going to partner. The caseworker is actually not delivering all the services. They're going to partner with all of our different agencies. Like in my case, the VA, which is 1,000 feet away. They have those services that are paying, and our residents who qualify for those services, we're going to pair them all together. So a lot of our service plans talk about the variety of relationships that we have with key partners like the VA, like other nonprofit groups, and that's how we're stretching that dollar. That's how we're bringing those services in. Yet at the same time, we're not sure how we're ranked against others, if that's the way it is, or there's special words we're supposed to have used. It's hard to tell. But because of that, that variable, good projects, in my opinion, were not eligible to receive funding because of it stated in some of our letters, points were deducted for insufficient discussion of the types of services or strategies for providing these services in a culturally competent manner to veterans, which I would love someone to define for me, because I feel as though we had a lot of cultural compatibility in the types of programs that we described. The other sort of point that was talked about earlier is this leverage of operating subsidies. Again, this is a 20-point category, very high point category. As a developer, we don't get to choose who gets vouchers, and those are the rental assistance, which are absolutely necessary when you are targeting that 30% are at risk of homeless or homeless individual. In order just to operate a building, you need to be able to take in some income to pay for water, sewer, lights, utilities. Well, the rents that we have to show don't even cover that. So we're setting up, unfortunately, structures that rely deeply on public subsidies and rental public subsidies. Unfortunately, all of the rental assistance, whether it be VASH or project-based rental assistance, are controlled by the public housing authorities, which in many cases refuse to project-base their vouchers. That's why you heard earlier, very few got any at all. Yet it's a 20-point category. I can tell you on one occasion, one of the housing authorities I've been working on for about a year and a half to get rental assistance, VASH, said that they would not put out an RFP, they would not project base any, and then earlier this year, miraculously, without anyone even knowing, they put out a request for VASH, a NOFA, Notice of Funding Request, and specifically excluded studio apartments, of which my development had some studios and another veteran project also had studios. Neither of us could apply for those rental assistance for the VASH. As a result, the Public Housing Authority got 0 responses for their VASH. Those are now lost. These are things out of our control, yet major point category for operating subsidy. The other subsidy that's available to us in the state is the state-run HUD 811 program, the one that our Garden Village project was the first in the nation to receive. Unfortunately, so those funds can be used for individuals that are disabled, that are exiting institutions. Very clearly, that is the definition. And we have to fall under HUD Fair Housing. So to pair those up with veteran-only housing individuals, you run into a little bit of fair housing problems. So again, we're having a meshing problem. The other problem with that funding source, which was very clear to us because we were hopeful to try to use it in a supportive housing project, was that you are capped by the federal definition. You cannot use those funds if you are building a special needs project that has more than 25 units dedicated to supportive housing. So this is where it comes into a greater problem when you pair it with the state tax credit. So we all heard that that is an absolute necessity for this type of housing, the low-income housing tax credits. It's the 9% tax credit, which is extremely competitive, and the 4% tax credit. In those definitions, there is no special housing for just veterans. You have to fit into a housing type category. You have to fit into a special needs housing type category, which requires that you designate 50% of your units to special needs. So in other words, that HUD 811 program where you're going to bring in vouchers, you can't have your project can't be more than 25% special needs. So no longer can you finance your project with 9% tax credits or 4% tax credits. So again, it's a pairing problem, because that means we're leaving lots of leverage on the table. So again, if we can have some flexibility in thinking about how we can overlay so we can reach deep into the other programs, it's going to be essential to the success of this program. What is also challenging is that because then you have to fall into the 9% tax credit where 50% are special needs, that means you have to be an individual with a disability and be homeless. That means you have to have either a massive operating reserve of $4 or $5 million, which will last you all of 15 years, with a regulatory agreement that's 55 years long. But you only have an operating subsidy that's going to take you to year 15. You have nothing else beyond 15 years. So what happens after that? None of us really know. So it's another challenge to be thinking of what we have to care about as long-term owners and operators of these properties is that we put on long-term regulatory agreements, 55 years or more. And yet we only have funding that's going to take us to 15. And yet we have these obligations to provide housing very specifically and prescriptive, the levels that we need to meet and the amount of social services that need to be provided. We have properties that this is generating are, frankly, in my opinion, not sustainable. So maybe we can think about whether it's bringing more resources to the table or maybe looking at allowing perhaps more loan funds to go towards these projects. One of the challenges, too, is that the 9% tax credit is very competitive, as we all know. One of the ways we can help the 9% tax credit is to get more projects into the 4% tax credit room. That means we need more gap financing under this program so that we can take advantage of the 4% tax credits and the bonds, which right now it's very hard to do. A lot of these deals are structured at 9% because we need all that equity because they're very expensive to build, and the operations of them, you need to fund up front $4 to $5 million operating reserves just to get you through 15 years because you start day one negative. You don't even have enough money to pay your operating expenses. Couple of recommendations to think about might be to establish a plan to look at how this pairs better with some of the existing programs out there. So maybe we can look at loosening up some of the regulatory requirements so that we can pair it better with existing programs that are out there. I appreciate and absolutely understand the need to have a lot of permanent supportive housing units, but the statute did talk about 50% of all the funds are going to be designated to the 30% of AMI or less, of which 60% of those 50% funds would be targeted to homelessness. Yet we heard earlier that nearly all of the projects were permanent supportive housing, which again is wonderful. Yet at the same time, if we were able to have different ways to leverage and different ways to create a more sustainable structure so that these buildings don't fail in 15 years, I would hope the state would look at that opportunity. Because what ends up happening is the sponsors and the owners of these will have a hard time selling the tax credits on these projects and also getting bank loans. And oftentimes we can't even structure permanent loans on these projects. So it really comes in as just a very capital resource and necessity. One of the other challenges is that these funds cannot be used for construction. Even though the funds are there, and I'm not sure if it's a prohibition, but the fact that the funds have to be a takeout, we can't use any of the funds during construction. So it costs all of us a lot more money. We're paying construction interest on all of this because we can't use any of this money to actually build the projects. We can only take them out after the building is built. So that adds millions of dollars to all of our projects because we can't use it during construction. So maybe that's another thing to consider as a possibility. The other one that I would like to sort of throw out, I did have an opportunity, I know the NOFA came out yesterday, but one thing I really would like to point out is that there are really two tiers of this program right now. It's both the supportive housing bit, where you have lead service provider, heavy strength on social services. The minimum point score is 100 points. Now, when you had a project that had a mix where you didn't have the deep level of supportive housing, that minimum threshold was 50 points. So if you notice in the project list, there were 3 projects that got just a little bit above 50 points that were awarded. Those projects fortunately made it in and were funded. Yet in the new NOFA, I happen to notice that that category has been changed. And so the minimum point score now for a mixed project that isn't supportive is now 65 points. There are no projects in this first round that even broke 55 points. So again, I'm wondering if we could pair this and really think about the future, because the hope, of course, is that we're going to provide a lot of housing units, but at the same time, keep these housing units as part of our stock as a resource for the long run for 55 years. And we want to continue to operate them for veterans, continue to operate them as housing that are sustainable. So we're not coming back to the state after 15 years saying we've got to refinance because we can't even pay our light bill. And I think that's a challenge because there are no operating subsidies. By the way, VASH, from what I understand, it's supposed to end in 2016. Yet at the same time, we have Congress making decisions on HUD and what funds are going to come for project-based Section 8. We can't get vouchers from housing authorities. I'm not sure how we're going to set up a structure where we have asked the developers to go find all these subsidies, yet at the same time, we can't get them because of the silos or because, they're not prioritized in this way. So again, I'm sorry, I'm a little negative, but at the same time, I'm hopeful because I care so deeply about our veterans and serving our veterans. We are doing it anyway, regardless of this program. And many of our housing, we accept many VASH tenants in many of our housing units. We design our services around them, and we will continue to do that. And I just hope that this is such a great resource and such an opportunity, and we are leading the way for the rest of the country in actually taking this bold step forward. I just hope that we can find a way to balance it and continue to look at financial longevity of all of these projects.